Today we're going to be talking about your job. Being a front desk, being a front office, dental receptionist, representative, whatever the name is, it's the front. You are the first person that anyone enters this clinic and sees, right? Does anyone see, do they see Dr. Hussein? Do they see Ms. Hiba? Do they see perhaps any of the nurses here? They don't see anyone. You are the first person to see, and that's the face of your center here, okay? What do you think is an essential quality to have as a receptionist? Let's look at some of the qualities, some of the characteristics that I believe are the most essential. There are lots, but these are the most. We have subdivisions in each category, okay? This young lady, she is a receptionist. What do you think of her facial expression? When you look at her, what's her expression? What does this face express to you?
Everything's all right.
Everything's all right. Perfect. Confident, yes. Communication skills, yes, definitely. It's very important. We'll talk about each one separately. Multitasking. What's multitasking? We'll be talking about that afterwards, okay? And social skills. It's very important to have social skills. Organized. Technical skills. Problem solving. Reliability. Empathy. Positive attitude and attentive. These are 10 major qualities, characteristics that have to be available in the personality that's going to be greeting the patients coming in this center. Document it in the system. Everything he says, everything you've given him, you have to document it. It's very important, the information, because you say you receive 30 patients per day on an average. That means plus or minus. You can't remember all the information given to you per day. So you have to, each person, you have to write. Because we have the MySmile and the technology, high technology here, so everything is okay, and this is part of your skills, okay? So everything has to be documented, fully. Why? Because Dr. Hussein, Dr. Ammar, Dr. Asma will ask you the patient so and so, you just punch on the button, yes, he asked for so and so and so and so and so. If you don't document everything that was said in the conversation between you via the telephone or face-to-face, something might be skipped, forgotten. The patient told you something important. You gave him information that's important. He tells the doctor, no, he didn't say this. You have documentation of everything that was said. And this is to help you and at the same time to save you from any mishap. Speak clearly and loud enough. What does this mean? Speak clearly. Now, of course, here we agreed that we are in a multicultural environment. Our patients are also multicultural. Your English, if you're talking to him in English, might not be understood. So always your pitch of tone has to be, remember the communication, pitch of tone has to be very clear, precise, direct, loud. Our patients might not be hearing us. They might have a hearing defect that they don't want you to know about. So don't let him say, what did you say? What did you say? I can't, speak up. Don't let him or her say, speak up. You speak up right away, okay? So always use a tone of voice that is heard very clearly, okay? Master nonverbal communication. What does it mean, nonverbal communication? What does it mean, nonverbal communication? Gesture. For you as a receptionist, receiving a patient, what do you think are the most important, two important nonverbal communication skills that you have to be, definitely, they are number one. Smile, yes, that's number one. Facial expression. Number two, eye contact. Very good. So we have eye contact. That's number one, essential. Look the patient in the eye. What does this give the patient?
It means that you're focused on
Your attention is number one, attention. You are interested in what he's saying. You are giving him full attention. I am focusing on you only. I'm not looking at the WhatsApp message. I'm not looking at a solitaire. I was playing solitaire before you came in. No, I'm fully attentive to you. Okay? So eye contact means interest, attention, focus. Huh?
And he's important.
He's important, confidence, trustworthy. These are all the qualities that the patient receives when he looks you in the eyes. He understands this person is very good. Now, just looking like this. He run away. He'll open and get out of this. No, but you. Yeah, nice smile. All of you have great smiles. That I can see that, okay? I think this was the first exam when you were examined with Ms. Hiba and Dr. Hussein. They want to see your smile. If you enter in the interview, I believe none of you sat like that. This is not a receptionist coming to take a post as a receptionist, okay? All right, so eye contact, facial expression, of course, these are some of the facial expressions. We don't want that. We want a smile. Put a smile on your face always. Now, the patient, he's coming with troubles. You have troubles. We all have troubles. But the patient, he wants to feel he's the main attraction. He doesn't care about you. He doesn't care about your worries or your problems or your troubles. He cares about himself alone. Now, it's sort of being selfish. Well, he's the patient. He's the one that's going to pay the money, right? Okay, so we have to always have a smile on our face. Once you enter this floor or the upper floor, throw your troubles away. Put them in the elevator. The last what you're thinking of your troubles is in the elevator. Once you step out on this floor or the floor above, it's a new day. Okay? And when you enter back, going back home, no, okay, that's okay. You can cry, you can be sad, you can be angry, you can be anything, okay? But don't put except a smiling face in front of the patient, okay? It's very important. Okay, so always be cheerful. Yes. Well, the environment is nice. So why not be cheerful, okay? All right, multitasking. Well, like this lady here, she's a multitasking lady. Yes. Yes, I believe a receptionist has to have octopus hands. Yes, we have to have spider legs or, or octopus legs, whatever. Okay, so when we're talking about multitasking, you are greeting people personally. That's number one. Number two, you're making appointments. Number three, you have a message and you pass it on to a fellow colleague, or you're going to Dr. Hussein or Ms. Hiba or whoever. You have to pass the messages. You have administrative work to complete. You have a lot of My Smile document, punch in and punch out, and lots of things. You're like, the juggler. You're juggling balls. Yes. Yes, your job is like a juggler. You're juggling things, okay? So it's important that you know how to switch from one thing to the other smoothly, in a calm way. Don't show that you're frustrated by or overwhelmed by so many tasks that you have to do. No, don't show this. You can go to the bathroom and do this. Scream inside the bathroom, but don't let anyone. Is there soundproof in the bathroom? There's no soundproof in the bathroom. Okay, okay, all right. So there's no soundproof in the bathroom. When you go home, do whatever you want to do at home. Okay? Yes. Scream out loud. When you go out by the sea, scream out go to the desert and scream out in the desert. Whatever. But here, don't show except a calm, peaceful face. Despite you have so many tasks that you are juggling this from that and this from that, you have several patients entering at the same time, and all right, I'll be with you in a minute. I'll be with you in a minute. Yes, ma'am. Yeah. Yes, it's a typical day, right? Yeah, it looks familiar, huh? You have, yes. Yes, yes, ma'am, I'll be with you in a minute. Yes, how can I help you? Yeah, you know, juggle but in a calm manner, all right? So that's the multitasking. Social skills. What do we mean by social skills? Yes. Now I can see you're all together. You are a member of a team. Sherry is your supervisor. Yes. Being the, I don't know, maybe has many years of experience. She's been here more than you guys. Well, it gives her this privilege. But at the same time, she's one of the team members. So you have to be all working together. Receptionists can't be a shy person. Can't be someone that, like this. This wouldn't be a social person. Being social means you have to get out there and talk to each other and work together, know how to collaborate with each other, okay? So, social skills, when you are like socially bound together, your patients will feel this. When they come in, yes, okay, Ashraf with Miss, like this, you share together. So the patients feel that they're in an environment, a homey environment, a very social environment, okay? Not an aggressive environment. Rami, take it. This is aggressive. What are you going to do with me? If this is in this area, what's going to happen inside that area, okay? Don't forget the patient is coming under stress. He is in pain, maybe. He is, believe it or not, subconsciously afraid of dentists, has traumatic experience previously in his past from dental work. So he's coming because he has to come. You are dealing with this type of patient, so you have to, first of all, be like the tranquilizer, the sedating to him. This is how you receive him. So in this room, in this area, this reception area, he wants to feel peaceful and that you are holding his hand till he enters that area that he's afraid to enter, okay? So it develops and builds relationships with your visitors, your clients. Of course, if he gets a bad expression inside this area, he might leave right away. Or he might not come back again. He says, no, the receiving me in the clinic was a total catastrophe. No, I won't go there again. Okay, so, and of course, a smile, okay? Organized. Now, I looked here now. Mm-hmm. Yes, yes, you, someone organized. Yes, when I said organized, someone organized promptly, yes. Yes, it's very important that when we enter, this, of course, it's high, you can't see, but I can just, when I'm standing here, I can see that it's organized. Because if we find paperwork, loose paperwork everywhere, it gives us a bad impression that you're not, you don't have a good filing system, you don't have a good documentation system. Maybe I'm giving you something valuable, some information that's valuable, and you might lose it. So this is very important. At the same time, if some paper information, maybe he has his medical report, maybe he has some x-rays, maybe he's giving you something that belongs to him, and you misplaced it, it's a sort of violation. It's considered as a violation, okay? So you have to take care of the area. It's clean, it's organized, everything is in its order, in its place. At the same time, well, he enters, there's a side table, there's, oh, nice down, yani, the area has to always be kept neat, tidy, and everything in place. Chairs properly placed, these things. This is, they like to see this. I myself like to, when I enter, yes, everything's organized. I have some patients, believe it or not, might be like myself, that they have OCD. OCD is people that have a problem with everything put in its place. Believe it or not, if I leave my house and a pillow is like that, and it should be like that, I return back to put it in its proper place. This is, Amr was waiting downstairs. We were going to the airport, and we have 2 hours. We have to be our home actually is very far away from the airport, and the time that we're coming, it's about 2 hours to go to the airport. Okay, and we have to be there before the plane by 2.5 hours. So we have to be leaving our house 4.5 hours before our flight. Said, Mona, down at so and so. Yes. Everything was down in the car, and I'm going down, and then, no, the basket. I went upstairs, I put the basket down, and then I closed it, and the pillows. Nobody's coming to our house. Nobody's going to be there the whole week. But knowing that the pillow is not in its proper place makes me irritable. And some of your patients might have this type of irritability. So you take care, you have to treat your patients that they all have OCD, okay? Technical skills, I think everyone has to, your generation, not mine, of course, your generation has to be skillful in opening a laptop, a computer, knowing how to enter, knowing how to put information on the My Smile software. These technical skills, I believe today, anyone that doesn't know how to use in your generation, doesn't know how to use a computer or whatever, iPad or tablet or whatever, is in another language stupid. Okay, in my generation, anyone that used this was considered stupid. Okay, that's the difference between my generation and your generation. My generation, we are the kind that we use our pencil and pen. The policies that we are working on, I need it to be hard copy because I like to hold paper in my hand and read from paper. I can't hold an iPad or a computer all day long and focus on I want to see the papers in front of each other. I know you can do that on the computer, but I don't like it, okay? So, of course, technically, I believe you have to have this quality. Problem solving, yes. This is a skill that has to be one of your main, because you might be facing a problem. So this is the problem, you have to think, and you have to come up with a solution. Ms. Heba, I believe that maybe in a facility that has a receptionist sitting and the patients, they're not specifically with each patient. I know that Ashraf knows certain patients because they're with the doctors so-and-so. Rami is with, Rachel is like this. Each one of you. This is very good. This is a good practice. The problem would be, if all of you haphazardly, the patients are distributed, anyone comes, the first receptionist that receives, oh yes, Rami will see him next time, Ashraf the day after. So this will cause confusion and we won't know how to solve because there's no backup plan. But you have to document.
You hit the point list, but they're not using
we said we have to document. We have to, any information given to us, any information that, say supposedly one of you is going to be on leave and you know your patients. Put some notes beside each patient for someone else that's going to be taking your place for a certain period of time that you're leaving the facility. Yes, exactly. Because believe it or not, the doctors get frustrated because if something is not organized, well, they have to pay attention to the treatment. You have to focus on the appointments and dealing with the patient, when to come and when to go. So he's relying on you totally on this issue. So when he finds that there's confusion in the scheduling and appointments of their patients, this causes frustration and they don't need more frustrations. It's enough the frustrations that they have to deal with the patient himself or herself. Just letting them sit down, sedated and open their mouth and being treated, whatever treatment they're going to be dealing with. This is a heavy burden. So you should be the one that takes off some burden, okay? And this is a very big burden, okay? So problem solving, this is very important. So remain calm and find a solution. It's very important to find a solution but remain calm. Don't get, he's already frustrated. Don't frustrate. If you're on the phone or face to face. Of course, face to face, he'll see your facial expression. On the phone, he'll hear the vibrations, the tone of your voice, the pitch of your voice. So he'll know. Miss Hiba yesterday, she was on the phone, an angry tone. If I was on the other side, she's very angry. She's not happy. So take care. On the phone, you have to have a very pleasant, calm, sound. Pitch of your tone has to sound like you are helpful. Not angry, not aggressive, not frustrated from the frustrations of the patient on the other side. If it's face-to-face, take care, eye contact, facial expression, smile, even if you are, no, don't show this, okay? Don't show this at all, right? So be calm and have to react and decide what to do. You have to put a decision. So this is a very nice policy. If you have a backup for each patient, this is a very nice. Newcomers, of course, you are still getting to know the patient. So it will take some time until you know what type of patient to categorize him under which level, okay? Reliability, yes. A receptionist has to be a reliable, responsible person. Yes, definitely. Why? Because now, if someone enters now and sees this facility, we're all outside, and this is an empty facility. I don't want someone to come and do like this. We don't want this bell, because someone has to be here, okay? So this bell should be always away, okay? No, but actually this is in hotels, in reception hotels, it's for, entering then because the receptionist might be inside, outside, or something like that, okay?
US hotel.
Yes, yeah. All right. At the same time, if you have a break time, it's from 12 to 12:30. 12:25, you're upstairs. Don't come 12:30, because 12:30 means that you'll be here 12:32 or 12:33.
This is our policy. The break is 15 minutes.
Okay, I'm just giving an example. Yes, I'm just giving an example that I know that the break time is 15 minutes.
50.
50 minutes, wow. Amazing, 50 minutes. Eat, drink, 50 minutes.
Instead of going to the
Wow. 50 minutes, that's a long time, Miss Hiba. Guys, you're so lucky. Okay, so break time, you have to be very punctual. She's giving you 50 minutes, but consider it 45. The 5 minutes is for coming back and sitting and being focused and ready to receive, okay? And of course, you have to be a very responsible person. What does it mean, responsible? Yes, confirmation of his appointment, messaging that he has an next appointment. All this is part of your responsibility and shows that you are responsible and you care. Being responsible shows that you care, okay? If you're an irresponsible person, you're a careless person, you don't care. You don't care about your work. This is very important. It shows if you're a good receptionist or if you're a bad receptionist. Okay, so empathy and understanding human behavior. What is empathy? Now, sympathy, you acknowledge that this person has a problem. This person has lost someone very dear. When you go to condolences, a person, his father or mother died, you just say, this is sympathy. I feel your loss. I'm sorry for your loss. Empathy, you are reliving. Someone very dear to you has died. So when you go, you hug him because you know how he feels at this time. This is empathy. So empathy is more emotional because you have lived his suffer. Now, you have patients here. How many of you had a toothache? How many of you have extracted teeth in extracted teeth? Yes. So you know what dental patients suffer. So you feel their emotions when they're coming out and doing like this. So just a pat on the shoulder. you'll be fine, don't worry. Showing some emotions and feelings to the patient makes him comfortable. Believe it or not, he might go out, I'm okay. Okay? But if he goes out and يلا مع السلامة القلب داعي لك يعني أو واحد someone else says I've been there couple of aspirin and you'll be okay tomorrow morning. That's not emotion. That's making him more frustrated. He'd be angry. Why am I in pain? Okay? But if you show that you understand his feelings, you understand his pain, this gives him some sort of comfort. Okay? That's the difference between sympathy and empathy. Okay? Positive attitude. What's the meaning of positive attitude? Yes, yes. Always look on the bright side of things. Even if it's a gloomy day, even if it's gray skies, even if it's raining and thunder light, even if it's so gloomy outside, okay? Even if there's a sandstorm, I know you have sandstorms like in Egypt. We had a very bad sandstorm, really bad one. Even if that's the weather outside, you're not affected. You're always cheerful and happy and looking at things on a positive. This gives the vibration, vibes. The vibes inside the facility is always cheerful and happy. But if you're like that, this is you're coming with a negative attitude. Nothing will go right, believe it or not. You're always in despair. You're always looking at things gloomy and black. No, look always on the bright side, on the white shades. Don't look on the gray shades, okay? So this is a positive attitude. Believe in yourself. Believe that you can do it. Don't say, I can't do it. We said you have a multitask. You have like an octopus legs, 8 arms, okay? And by the end of the day, no, I can't. I'm going to resign tomorrow. No. I can't do this job anymore. No. I'm going to stay at home. No. Take it easy. Take a deep breath. I can do it. The day has passed. I can do it. So if the day passes and you have done it, so you can do it again and again and again and again. So that's the positive attitude I'm looking for, okay? So positive attitude always. Attentiveness, we said, be attentive. Look to your patient. Receive him with a smile. Hear him. We're going to take on Thursday active listening and understand what's the difference between hearing and listening. But now I just want you to know that being attentive is being focusing and looking at your patient with attention, okay? So give an example of a situation where you had to handle a difficult patient. Give me an example. Difficult patient. Yes?
Yesterday.
Yesterday. That's a song, by the way. Yani. Yes.
One of the patients very phobiotic and he's always afraid of the extraction and session. So I had to treat him like a baby. Calm him down.
Yes.
He put inside him.
Yes, it's part of your job. You know this. He looks afraid. He's terrified. Oh my goodness. Oh my goodness. So how you just patted? You kept.
I talked to him like my daughter.
Okay. You dealt with him like how old was he?
Maybe 37.
So you dealt with him. Your daughter, how old is she? 11. So you treated a 35 as an 11-year-old. Yes. You thought of your daughter, if she's in the same situation, this is how she would look. So you started dealing with her, him, like your child. Yes. Anyone else has a difficult patient that you are? This patient doesn't like to wait. This patient is afraid. Treat him like a child. Yes. Give. What did we say? We are working as a team, guys. We are working as a team. So being a team, yes, we have a host that deals with each patient for the doctor. But at the same time, maybe the patient will come when you're not available, so maybe Rami will receive him. So if he sees the patient beside him a note that explains his situation, he'll deal with him immediately. So your duties as a receptionist, let's tell me your duties. Number 1, answer phone calls, yes. Booking appointments, yes. Documentation, coordinating with other departments, yes. Greet patients. This is the number 1 duty. We said you are the first encounter with the patient. You are the first thing that he sees when he enters this facility. So you have to greet him. You have to show him what to expect inside. You are the mirror image of the facility. So if you know that, your responsibility is the face of this Vision Dental Center. If he sees a gloomy face, if he sees you're a tired face, you don't look happy. To me, you don't look happy. Believe it or not, I want a happy face. You are the mirror image of the facility. You are representing Dr. Hussein, Ms. Hiba, you are representing Dr. Amr Labib, you are representing Dr. Ammar, Dr. Asma, all the personnel inside the facility. You are the representatives. You are the receivers. So you have to show them what to expect. Okay? New patients and old patients. You have to show each one that you are always the same. They don't want to see you the first time smiling because he's a new patient. Then after that, inside. Every time he has to see you the same smiling, the same greeting, the same way. I don't like this idea that you are dealing with the patient because you want to take the card bonus. Come on. Bonus will come, but you have to do your job right, okay?
More than bonus.
Yes. Answer phone calls, of course. We talked about answering phone calls. We're not just seeing patients face to face. We are dealing with patients on the phone. The vibration of your tone, your pitch of the voice has to be very clear, has to be in a loud, clear English or Arabic if he's talking Arabic, okay? Language. It has to be very precise. Everything that is said, documented, written, all right? At the same time, don't sound frustrated, don't sound angry, don't sound sad, you have to sound pleasant and happy, cheerful. Even if he's on the other side, fearing the coming, he doesn't want, you're confirming the next appointment, and he says, okay, can we postpone it to another time? Problem solving. What would you like to, don't, this is going to make a problem because shifting appointments is going to damage the whole, focus on check-ins, checkouts, follow-up appointments, scheduling, providing telephonic reminders. This is your duty. So number 1 duty, greet patients. Number 2 duty, answer phone calls. Number 3, focus on the check-ins, checkouts, follow-up appointment, scheduling, and provide the messaging of confirmation of next appointments. Preparing the patient's charts for the day. Now, each one knows that today so and so and so is coming at 9 o'clock, 10 o'clock, 10:30, 10:15. You have to start because the doctors have to know what they're dealing with their schedules today. I know that you do this. This is part of your duties. Yes. Assist patients to fill out. Yes, the patient is coming in and he has some information that he has to give. He might not understand some of the wording that's written in the form. You have to assist him. You have to help him. You have to make him understand. If he doesn't know how to write, if he's in severe pain, you help him and you write. But if there's a signature, he has to sign it, okay? Okay? So you have to assist the patient to fill in all the forms that he has to fill in. He might have some questions. You have to answer these questions. Now, this is very important. If there are some questions that you don't know the answer to, what do you do? Very good, very good, very good, okay? If the senior doesn't know the answer. Yes, very good. It depends on the question. If it's something related to billing, that's management. If it's something dealing with dental treatment, then you will ask the doctor, what should I answer about these questions? You can always start gathering frequently asked questions by the patients and divide them. Put some questions that are managerial questions and put some questions that are treatment questions. And put the answers so that you would know how to respond on each question. Okay? Do you have that?
Yeah.
You have that? You do? Yes, this is a very good idea. Just collect all and each time there's a new question, just put it in its slot. Frequently asked questions, is it something administrative or is it something treatment, okay? And this way you always remember the questions and the answers, how to respond on the spot. And at the same time, the patient will hear the same response from each one of you is the same. And this is very important because we don't want the patient to say that Rami said so and Sherry said so and so. No, all of you stick to one answer. And this means that the facility is a teamwork facility. But if he hears Ashraf say something and then Dana says another thing, he'll feel that you don't know the answer. You don't know the answer actually. Yeah. So this is not good. Okay. We said that you have to have a policy knowing the answers to each question. Now, say you don't know the answer. Like you said, I will get back to you immediately. And immediately means immediately.
Yes.
Now, if, yes, or 9 months. I mean, it's not a delivery of a baby, okay? Miss Heba said that one patient was put on hold 9 months. 6 months, okay, 6 months, okay. Okay, that's a delivery, another premature delivery, okay. File important documents, update patient records, document recent treatments and procedures. Everything has to be documented. And on the spot. Now we said, if you postpone something for later, if you postpone something for the evening, after work time, you'll sit down and on the desk and write everything. You'll miss something. The point here, I'm giving something and you have your boss, Ms. Heba and Dr. Hussein, they're here and hearing and they know some of the problems that you encountered. And that's why we are focusing on these problems, okay? It's very important, documentation. I was sitting here the day before and I heard some problems. It was actually all about documentation. You postpone documentation. Dr. Amr Labib says that sometimes you postpone what he said to you. And then, because he always writes, he makes notes and he takes photos, and before coming, he sees, the patient's so and so, I'll be doing so and so. He knows what he'll be doing. If he relies on the assistant or he relies on you guys, I don't know what will happen. It will be catastrophic. And so please, on the spot. Don't postpone, don't delay something, because you don't know what will happen 5 minutes from now, okay? So if you deal with it immediately, this is very good, okay? Keep the reception area tidy. Now, I know we're not supposed to be cleaning, we're not the cleaners, but if you find something on the floor, okay, ask the cleaning person to come please remove this. Always keep the area, it's a small area. It's it's not a huge reception area, okay? If you find the chairs, there were 2 patients sitting, he came with his family and they sat together like a group. After they go out, return everything in its place. So always keep the place in order, okay? It's nice. And I thank you very much. Did you benefit from what we said today?